a benefit, a relative risk or absolute risk, also known as the numbers needed to treat NNT. So if you communicate relative risks, as opposed to NNT or absolute risk, it can actually lead lay people to, and doctors also, to overestimate the benefits of a treatment. So let me give you an example. For people with type 2 diabetes, the published medical literature, tells us that if you take atorvastatin, a cholesterol-lowering drug, 10 milligrams every day for 4 years, there's a 48% relative risk reduction in having a stroke. That sounds quite impressive. You're 48% less likely to have a stroke if you take 10 milligrams of atorvastatin every day for 4 years. But what does that actually mean when you look at the data? Well, it means you reduce the risk of having a stroke from having no treatment, no statin, from 28 in 1,000 to 15 in 1,000, which means there's an absolute risk reduction of 1.3%. So what does that mean for the individual in real terms? The actual way to say to that patient is if you take atorvastatin 10 milligrams every day for 4 years, there's a 1 in 77 chance that the drug will prevent you having a stroke. Very different to 48% relative risk reduction. Most people do not benefit. The benefits are small, but you may decide that that benefit is good for you, or you may decide it's not. It's very different.